Hello, Ajit.
Yes.
Hello. How are
Yes,
you?
Roman. Hello. Hello, Roman.
Okay, so we will continue our homeopathic talks on a very actual topic. So, first of all, tell me in 1-2 sentences, very shortly, but it's very interesting. What's going on in India with COVID right now? And maybe through you, you know what's going on in other countries. It's very interesting because you are treating patients from all around the world.
Roman, in India, in big cities, at least in my state of Maharashtra, where Mumbai and Pune are the big cities, Corona is increasing very rapidly, badly. And this is basically because once we lifted the lockdown, there is you see increase in the quantity of all the cases. The second thing very important is that New Delhi has a large percentage of coronavirus cases as far as India is concerned. However, we must give due thanks and respect to the government, central government especially, and the state government also, which are trying their very best to contain the spread of the virus. But you know that people are people, they don't listen, they just gather together for many functions. They don't want to follow the lockdown, they want to do their business. And this is the reason why the spread is increasing in India. So it is a big job now to give the lockdown again in many places. And moreover, in India, the use of the arsenic album as a prophylaxis has been found to be very useful in many research studies. And it is being now taken up by many social organizations, NGOs, then many you see charitable institutions in India, many homeopathic colleges and hospitals, and they are giving you see almost a free or at a very minimum rate arsenic album as a prophylactic remedy, as an immune booster remedy to millions of people in India. Because
what you're telling is that the remedy, the prophylactic remedy you are using in India, still arsenicum album 30C, and you give it.
We are using a 30C. We are giving it in 30C potency, 200 potency also. In young people who are asymptomatic but they are in the red zone, I will give a 200 potency once every week also in the red zone.
Okay.
Red zone is an area where you have definitely found a person near you in the same colony.
Okay.
Yeah.
Okay, and what about other countries? As far as you have information about that? About other countries, do you have some information about that?
I have the information also about other countries. The first is that as far as the Europe is concerned, Europe has loosened the lockdown. But Europe, I think as a whole, France, Italy, Spain, and some other countries which were mostly affected, there is a lessening of the wave of the spread of the coronavirus. And I think the death rate has also fallen down, although new cases are coming up, but the peak is much less in most of the European countries. But if you take America, for example, it is very unfortunate that Corona is increasing very, very rapidly, and millions of people are getting affected. And I think the main reason is no lockdown. People don't want to follow. People want to not go away from their so-called materialism and entertainment as a life and all these matters. Because as a Corona outbreak, I think we have a big challenge to re-study, to readdress our views against the life. And probably if we are not taking the lesson and we think that, yes, life is only for entertainment and amusement, then I think you will have to pay the price of it also. And American people are paying the price of this. So they must learn that to remain locked down doesn't mean a grief, but to be with whatever you see, you have the life. your adaptation to the life is much more important than what you think you see. So I have rather a very stern and warning to the American psychology to change their psychology of materialism. Change the psychology of materialism. This is the only answer to the problem. Yeah, yeah.
Ajit, another question now. We have a lot of cases where people suffered from COVID, went to last stages. And I think that you have the same experience. If not, you can add. We have an experience that in many cases it's a very long story. And this is a very severe pathologist if they went to some complications. And what is interesting, even in so-called easy cases, it is very long. It's kind of, you have a tail of the disease and it's not finishing. The question, do you have such experience in India as well? And what do you do with these last stages after the peak?
Yeah, yeah. You see that we will leave aside because your question is more related to the complications of the COVID-19. As far as 50% of cases are concerned, these cases really need a big vigilance, monitoring, and a good amount of the treatment with skill interview, skill objective data, and to treat in a homeopathic way. In a way, we treat the acute disease and the subacute disease. Now, instead of calling corona as an acute disease, I would like to call it also as a subacute disease, because the whole course is running not below 21 days. Almost you are getting 3 weeks to 4 weeks, even 5 and 6 weeks of the total recovery. And if you take into account the mental state of the patient, the physical weakness, which many patients are having, they have a delayed convalescence period also. The recuperation is very delayed. So you can extend it even beyond 4 weeks. Now, your question is related to the complications. In the complications of corona, the first one is a respiratory infection of the lower character, which goes to develop the pneumonia. Now, the pneumonia appears to us as a first small pneumonia in spots, and gradually it increases in some cases, and in some cases it is very rapid. And this hourglass, opacities which get clear, which gets developed in the pathology, is a very serious condition where the lung doesn't remain, the glass remains. So there are no alveoli. And then there is a respiratory collapse. This condition requires oxygen. Ventilator has been now challenged by many people, and some people say that it is dangerous to give ventilator. This is all a matter which is going on. We will not go into that particular aspect. But for this particular condition, we have to be very careful how we can treat such cases. In such cases, I think with such type of arrested respiration, the ARDS, one of the best remedies we have is carbovegetabilis and antimonium taltoricum. So if you find that patient is really going downhill, in this particular state, begin at once with antimonium talt, mostly in 200 or 1 potency every 15 minutes, every 30 minutes, in order to avoid this particular complication and to reduce the breathlessness. Now, in some of these cases, previously it was regarded that it is only the coronavirus which is responsible 100% for the pneumonia. But new cases are coming up where there is a superimposition of the bacterial infection, what we call as a secondary infection. Previously, it was regarded that the septic foci which get developed, the suppurative processes which are a part of this pneumonia, are exclusively due to virus. But this has been challenged in some of the studies. It is found that there are some bacterial infections, secondary bacterial infections, which may accompany or may be a part of the then pathology. Now, in order to treat this particular pathology where the chances of fibrosis are much more, Because you see that when the fibrosis occurs, you lose the original lung tissue. The original lung tissue is replaced by the fibrous tissue. And you have to understand the whole process in the sense that you see this particular way of understanding is related to, you see, over immune response due to the cytokine storm, and then hypersensitive response that occurs goes to cause scarring, because there are multiple wounds that get created in the lungs. And as a part of the fibrosis, because fibrosis means in one way defense of the body, in another way it is the death of the alveolar tissue. But because of the fibrosis, the pneumonia is contained. So if the pneumonia is patchy with fibrosis and some spots may be multiple or fibrous, okay, whatever remaining part of the lung is there, it will do the function in a limited pulmonary function way. However, in order to prevent this pneumonitis with fibrosis, I would like to suggest to you the methodology of remedies. The first remedy I will take into account is phosphorus. If you see, phosphorus and fibrosis, any other way also goes together very well. You know the condition like tuberculosis, for which pneumonia is used since almost in homeopathy 260 years. Now, the main theme of the pneumonia is a rapidly developing pneumonia, which then results in the fibrosis. So, phosphorus I will take as a first remedy in order to prevent the fibrotic changes that occur. The second remedy, when you are taking up fibrosis as the remaining part, I mean to say that the pneumonia is resolved now, patient is living, there is no death of the patient, the pulmonary function is compromised, and you have the pathology of fibrosis. In order to remove this pathology, which is a very difficult one, what we call as an adhesion breaker in homeopathy, the first group I will take into account is a carbon group. Out of the carbon group, we have graphitis, carbovegetabilis, carboanimalis, and carbonium sulfuratum. These four remedies are always for resolving the fibrosis. So you can reduce the fibrosis and you can see whether the lung function is improved with these remedies. Because every carbon remedy in homeopathy is for the sake of improving the lung function by giving just like more oxygen. So you can say that carbon remedies in homeopathy are just like giving the oxygen in a potentized form to our patient. The other remedy you will find out of the carbon remedy, the most prominent remedy is graphitis. Graphitis has been termed as an adhesion breaker, and adhesions are nothing but the fibrous tissues. So you must think of this remedy also in low potency, like 3C, 6C, 9C, 12C potency daily being given. You can even think of 30 potency as a single dose daily for a few days and to see the effect of this. The other way to consider this one is a silicea. Silicea, you know very well, is a remedy of fibrosis. You know, in silicea, a big problem is about defective phagocytosis, due to which there is a suppuration, there is a wound unrepairing state. So naturally, after you give silica, the wounds start healing. The suppuration which has been accumulated in the lungs because of the coronavirus, they start getting resolved, absorbed due to silica. And silica in such a way is a wonderful remedy to resolve the fibrosis. So this is about carbon remedies, about silica. Now, if you take into account the fibrosis as a general, we have a very specific remedy called as a thiocinamine. Thiocinamine is also a remedy for the fibrosis. So after the patient is cured and the pulmonary function is compromised, you can think of thiocinamine in low potency being given daily for a few days. And then again see the effect, the pulmonary function, the X-ray if necessary, so that we will be better in a position to understand what our remedies have done to the system. Now, in order to resolve the fibrosis, as I have already written in my article, one of the best remedies is tuberculinum. tuberculum, especially bovinum, Kent. Also, bacillinum can be thought of, but I'm more in favor of tuberculinum because of the rapidity, because of the destructive tendency, because of the fibrosis. Tuberculinum, you know, is given since almost 200 years in homeopathy for the sake of unresolved pneumonitis. So when the pneumonitis is unresolved, the patch is increasing, not decreasing. The system is under the sway of the infection. Tuberculum at this stage will build up the immunity so that you could deal with the pneumonia in a far better way and avoid the fibrosis. So the planning which I would like to do when the thirst is extreme, thirst for cold drinks is very extreme, there is a extensive inflammation in the lungs because of the pneumonia. Patient is downhill, severely weak. In addition to that, you have a intravascular coagulation, some thrombosis, bleeding internal. Patient is on IV fluids. Maybe patient requires some blood transfusion, maybe oxygen. Such a moribund state, you must think of phosphorus. And along with the phosphorus, by looking at the phosphorus 2 days, 3 days, if you see that phosphorus is not working very well, you can interpolate a dose of tuberculum 1M or even tuberculum 200 to boost up the energy. There is a very interesting, you see, observation as far as you see ferrum phosphoricum is concerned. Now, you have to understand the indication of the ferrum phos as given by Bodland and the indication of the ferrum phos now as coming because of the development in physiology and pathology. See, almost 100 years back, Bodland presented a book on pneumonia where he said that if the pneumonia is developing and if you give ferrum phos in high potency frequently, 1M, 10M or 50M, you could abort all the further processes. This was what he wrote. Now it is very interesting observation. The fever is very high, pneumonia is getting developed, pulse is very high, patient has very intense inflammation, and it is a kind of a, you see, a red hepatization state. Then if you give pneumonia in high potency, you could prevent fibrosis in the lungs. Now currently thinking you will find, if you know, there was a consideration that these S2 receptors are also associated with 4 types of the heme. So hemoglobin has a big role to play, and this is related also to some other pathologies like intravascular coagulation and thrombosis. These are the pathologies in relationship with COVID-19 are also covered very well by ferrum phosphorica. So at a very critical stage when the pneumonia is developing, and it may go to cause this hourglass opacity and also extensive damage to the lungs by sepsis and fibrosis, interpolation of ferrum phosphoricum in high potency every few hours, like 1 hour, 2 hours, 3 hours, will really help the system to tide over the acute crisis which has been developing. Now it is here that some of my students under my guidance have begun working at this particular stage, and we have the data of, you see, almost more than 60 cases where ferrum phos at a very critical stage is really helping and not allowing the patients to go further in deep pathologies of fibrosis and hourglass opacities. This is a very important observation, and we are keeping the record of this. And when the record will be complete with all these, you see, research protocols to be applied, I think we will be able to give you a good paper over this. This is a recent development in, you see, under my care as far as this week is concerned. And we have a linkage with some allopathic doctors, and they are working with some of my students, and they are taking my guidance from Mumbai, Pune, some other parts of the Maharashtra state. And we are finding that ferrum phos at this particular stage, of course, we are not limiting only to ferrum phos, but most probably at this particular stage, ferrum phos is found to be extremely useful. This is also a reality.
So, according to you, this ferrum phosphoricum, this last stage to prevent fibrosis.
You cannot call it as a last stage. You could call it as a developing state which can go out of the control and which can go definitely towards fibrotic changes. So that particular stage, you may not call it as the last stage. Yeah.
Ajit, in clinic, how you will see that this is the stage and when you will apply ferrum phosphoricum?
Yeah. The first thing is that the fever is intense. Maybe you will find above 39 degrees centigrade, 40, 41 or something. Then the whole body has become red. The third point, which is very important, is the pulse, which is you will find full and bounding. The fourth is the report of the X-ray before you, where you will find that you get the pneumonia definitely, and there is an enhancing patch of the pneumonia. So if you find this totality and some other symptoms of the ferrum phosphoricum as given very nicely by Bodland is in his pneumonia book, then you will find that the ferrum phos can be a very good remedy. In the ferrum phos also, I have observed, you see one, hemoptysis along with the sputum. And second thing, it may be associated with hemorrhage somewhere. So if you have a blood in sputum, if you have hematemesis, if you have internal hemorrhage in the system, melena, where the stool also contains the blood, then one of the good entry points is ferrum phosphoricum. Yeah.
And the difference between ferrum phosphoricum and phosphorus in such cases?
There is a difference. Yeah, there is a difference. The difference is that you see, phosphorus I will take as a further stage, intensified furtherance of ferrum phosphoricum.
In case when ferrum phosphoricum will not work, you will give phosphorus.
Yes, correct. And we see the further progress of the pneumonia because phosphorus is too destructive in comparison to ferrum phosphoricum. But ferrum phos is more for the sake of, you see, prevention also. I mean to say that when you give ferrum phos, you achieve a lot of things. You also prevent the hemorrhage because in the monogram study of the, you will find ferrum phosphoricum, we have also given hemorrhagic as a diathesis of ferrum phosphoricum. Yeah.
Okay. Ajit, thank you very much for this short and very important
yes.
interview. So we will be in touch, and I hope we'll be in touch very soon in very different circumstances.
Yes, Roman. Yes. Okay. Thank you, Roman.
Thank you.
Yes.